Hi, my name is Amanda Martin. I am completing my kinesiology degree at the University of Regina. My major is human kinetics. I completed my fieldwork placement at First Steps Wellness Center in Regina. First Steps Wellness Center is a nonprofit organization that uses innovative activity-based therapy for people with spinal cord injuries and other neuromuscular disorders. My special project focused mainly on brain injuries and functional movements. I chose to focus on brain injuries as First Steps has seen an increase in number of brain injuries in their facility. I chose functional movements as functional training has a purpose and it translates to an activity beyond a workout. A brain injury is an injury that results in the disruption of the architecture of the brain and its pathways. I chose to work on functional movements and patterning because exercise is the most potent factor in the production of brain-derived neurotrophic factor, which increases the sprouting of new neurons and increases connections of existing neurons. In using these functional movement patterns, we are hoping to repattern and start new patterns that the nervous system will then build new connections. I chose functional movements like pushing, pulling, squatting, lunging, hinging, carrying, and rotating. I used a modified functional movement screening as a tool for an assessment of the squat and lunge. I completed a pre-program but was unable to create a post-program assessment. This was just due to the COVID guidelines at the moment. I faced challenges like completing a program over Zoom. Doing at-home programs has its own list of challenges, like the limited equipment, having correct and good communication between client and therapist, and eventually I was sent home and had to complete these programs at my own house. Yet I was lucky enough to have mentors and good guidance on how to complete things. I was lucky to have people passionate about rehab just as I am, who could answer all my questions. I believe this program was successful as my client has seen benefits in balance and coordination and has seen improvements in getting in and out of a chair, in standing on one leg, and has been able to lift more weight. I believe that this program, or the foundation of a program, is beneficial for First Steps, as they will be able to use this to create more programs in the future.